So I was saying something about the manifestation of absence of good, reliable, stable object internalization, how the difficulty of internalization plays out in psychopathology. And we took some examples of psychosis, personality disorders, anxiety spectrum disorders, addiction disorders, some of them, and identity disorders, some of them, in which we see at the core the difficulty of not having internalized a good, reliable, stable object. So this is something that we see very commonly in our psychotherapy practice. And one of the things that psychoanalysis does, which many other forms of therapy can't do, is to facilitate the internalization of a good, reliable, stable object over a long period of time. That's one of the advantages of a long-term therapy.
So is this an area where only psychoanalysis is good at and short-term intense therapies fall short? Is there a cultural aspect to it?
Let me separate the two parts. One is the intertherapy comparison. And in the intertherapy comparison, you are right. On this particular point, psychoanalysis, person-centered therapy, humanistic existential therapy, cohesion holding therapy, they are much better placed than therapies which confront, maybe mildly or maybe strongly, to facilitate internalization of a good, reliable, stable object. Especially if somebody is coming to you thrice a week for a sufficient length of time, and you have been a good object by and large, the chances that he would internalize you to whatever extent he can, that would enhance his health, his quality of life to a great extent. And that we see happens even in ISTDP, where they are dealing with fragile patients, that they can't take confrontational stance, although the whole therapy is based upon confrontation and challenge. They have to get into the cohesion supporting mode. But the question is that if you have to get into a cohesion supporting mode, then why go under the framework of ISTDP? Go for frameworks which are designed specially for this. So if you look at the classical psychoanalysis, the cohesion psychoanalysis, they are classically designed for safety, for internalization of a good, reliable, stable object, for unhindered articulation of desire, for freedom of the patient unhindered, and where the catharsis happens in small amounts over a long period of time. And much of the need of catharsis is eliminated in many situations by a deep and thorough analysis, a kind of special kind of analysis which erases the affect generated at its roots rather than releasing it in catharsis. So these are very designed, so to say, for a set of objectives of which internalization is one. Whereas the challenge-oriented therapies, maybe a mild challenge of CBT or an intense challenge of ISTDP, they are geared more towards cognitive corrections or catharsis, affective, large volume affective catharsis. So this is definitely an area where psychoanalysis is on a much stronger ground than many other contrasting therapies.
So is there a cultural aspect to it? Has it been changing ever since the existence has taken place? As you're talking about the environmental factors outside in.
Yeah.
How do you see that under the light of cultural aspect?
It's a very good question, because it is not only a interpersonal question that remains intra-family, this is a question that goes out of family into the larger culture. And we talk about psychosocial causation in psychoanalysis, but really we don't implement it. This is a point which Kohut had also brought in. Kohut had talked about two concepts, the guilty man and the tragic man. Kohut used to say that the type of patients Freud saw and the type of patients he was seeing were very different. Freud saw patients who essentially were fighting repression of desire. And Kohut saw patients who were essentially dealing with object inadequacy. So Freud's patients, he used to call them the guilty man, who is guilty of his desires. Desires are too strong for repression, and there is a guilt of having that excess desire, that surplus. Whereas in his case, it is the object deficiency or the wrong object internalization which is at work. And he also mentioned that where are the hysterics now? The type of hysterics which used to flood Freud's consulting rooms, why are they not flooding the rooms now? And narcissism, which used to be confined to a small section, why is it so universal now? Obviously, it has nothing to do with one family or the other. It has to do something in the society. And therefore, there is a cultural aspect to what pathologies gain momentum in a given time. There is a historical facet also to psychopathology. And therefore, when we look at it from that point of view, we look at the Western societies where, because of the modernity and the lifestyle that modernity brings about, post-industrial revolution, this entire modern era has been an era of continuous reduction in availability of good, reliable, stable object. It's an object famine, or rather a good object famine, let me say it that way. The whole modern era has been a good object famine. And now you have in USA the third generation, which is continuously experiencing object loss, object inadequacy, internalization problems. And just as we say that the third fully educated generation creates a different country. Similarly, a third object loss or object inadequacy generation, that also creates a different country and a lunatic country. And the entire woke movement that you see is the outcome of it. That for 3 generations, the object inadequacy, partly out of loss, partly out of bad objects, partly out of difficulty of internalization, it has cascaded and intergenerationally it has got transmitted. And now we have a woke movement where, if you look at wokeism at the root, it is the irrational rage of a fragile narcissist. And one of the reasons is early life object inadequacies, lack of holding, lack of containing, lack of training into the hard and the good way of life, the right way of life. And therefore you have the lunatic woke that constitutes almost 55% of USA and probably the same percentage in UK. And you also have a loneliness pandemic. And you have the autoimmune pandemic. So if you put these 3 together, the woke pandemic, the autoimmune pandemic, and the loneliness pandemic, and the personality disorder pandemic, and the fragility pandemic, if you put these 5 pandemics together, you see the outcomes of early life object inadequacies. There is an old saying which says, it takes a village to raise a child. that village has disappeared. And now we have a object famine, object scarcity. So the outcome of that is, if you don't internalize a good object inside, and if it happens on a mass scale, the empire falls down as the USA is falling down. So you have a good omnipotent object inside, you have a good omnipotent object outside. So there is a social and political expression of this inner crisis that we see across the world very vividly. So there is empire inside, empire outside, deprivation inside, destruction outside. And these are culture-wide phenomena. One more point, there's also a class angle to it.
Mhm.
The lower the income, more object loss the child experiences, because both of them have to work. They don't have any facilities, so the anger comes out very easily. They are the ultimate containers for the society. Everyone dumps everything ultimately on them, and they can't express and do catharsis because of the reality conditions. So everything is bottled up inside. So the objects also become bad objects. The parents are not able to be good parents, soft parents, delicate parents. And therefore, you see, there is a class angle to the early life object internalization and inadequacies and object losses experienced. And if you do any psychological test, it will come out that in the poorer sections, the bad object issues, the object loss issues will be, compared to the middle classes, much higher. And one solution, therefore, for that point is to have a social security for first 7 years of the child. Give adequate money to the family, especially the mother, for the first 7 years. If you want early life good object experiences and good internalization to happen, and thereby a good biological, psychological, and social health to happen, and to build probably great empires. But there is a long, long way to go. World is yet to accept anything called a global psychological pandemic or internalization crisis or object crisis, as we understand it in psychoanalysis, years before we would reach there.
Wow. Right from that inner microscopic, inner psychic world to the larger magnifying lens of cultural aspect. It was an indeed enlightening discussion for us. Hope our viewers also enjoyed and liked it deeply. See you all again. Thank you once again, sir. Namaste.
Namaste.